so you've started needing an extra pillow to sleep. Or maybe you find yourself jolting awake suddenly to sit up to catch your breath. It's easy to brush off, right? You're getting older, maybe a little out of shape, or maybe just a bad dream. But here's the question: when does needing a few extra pillows to sleep go from being a minor annoyance to being a sign of a cardiac crisis that need immediate attention? So here are 7 red flag signs to take note of, counting down from 7 to 1, because number 1 is the one that can be an emergency. Before we go any further, we have to stop. This part is critical. If you're experiencing severe shortness of breath, even while sitting still, if you have crushing chest pain, if your lips or skin are turning blue, if you're fainting, feeling confused, or coughing up pink frothy liquid, stop this video right now and call your local emergency number. Your life could depend on it. Now, for everyone else, let's talk about what might be going on inside your body. Think of your heart like an incredibly powerful pump. But when that pump starts to weaken, a condition known as heart failure, it just can't keep up with its job. Now, during the day, gravity is actually your friend, helping to pull the extra fluid down to your leg and feet. But the moment you lie down flat, all those fluid in your legs start rushing back to your chest. A healthy heart will just pump it away, no problem. A weak heart, however, gets overwhelmed. When that happens, fluid can leak into the lungs, creating that terrifying feeling that you're drowning. The medical term for this is pulmonary edema, and you absolutely need to know the warning signs. Now, waking up breathlessness in the night is not always a heart problem. It can be caused by other things like sleep apnea, asthma, COPD, acid reflux, a panic attack, or even a bad infection. This video, however, is laser focused on the red flags that specifically point to an urgent problems in the heart. Now for a quick disclaimer, this video is strictly for educational purposes. It's not a substitute for personal medical advice. If any of the things I mentioned sound familiar, you need to go see a doctor in person. And if you believe that knowledge is power when it comes to your health, do me a favor and hit that subscribe button, turn on the notifications. That way, you will not miss out on information that can make a real difference in your life. Before we count down the red flags, here is a simple action plan. For red flags 7 through 5, you need to get checked out by your doctor urgently, and even sooner if the symptoms are getting worse. For red flags 4 through 2, especially if they are new, getting worse, or happening with chest pain or dizziness, you will need to be seen the same day. And for red flag number 1, that's a full-blown medical emergency, and you need to call for help immediately. You're sound asleep, and then an hour or two later, you're jolted awake, gasping, and feeling like you're suffocating. This all goes back to that fluid shift. When you lie flat, fluid moves back from your body into your chest. A weakened heart can't pump out this fluid fast enough, so it then leaks into the lungs. The medical term for this is paroxysmal nocturnal dyspnea, PND, and that's what causes that awful feeling like you can't breathe. This isn't something to ignore. It requires urgent medical attention to find out the cause. You've developed a dry, hacking cough, or maybe even a wheeze that isn't too bad during the day, but dramatically gets worse as soon as you lie down to sleep. Doctors sometimes refer to this as cardiac asthma. It is also triggered by that same fluid in your lungs, which then irritates the airways and then makes the body try to clear it out with that persistent cough. If you're having persistent cough, especially at night, without a clear reason like a cold, it is important you visit your doctor. Your ankles or your feet look puffy. When you press a finger into the skin and hold it for a few seconds, it leaves a dent. This is called pitting edema. When a weak heart struggles to pump blood forward, pressure builds up in the veins. This pressure can then force fluid to leak out into surrounding tissues. Gravity then pulls that fluid down to your feet and ankles as you go about your day. Any new or worsening swelling in your feet, especially both feet, need urgent assessment by a doctor. This isn't about just being tired. This is a profound, soul-crushing fatigue that no amount of coffee can fix. Simple tasks like climbing up the stairs or carrying groceries feels like you've run a marathon and leaves you gasping for air. This happened because your heart's main job is to deliver oxygen-rich blood to your muscles and organs. And if the heart is failing, it can't supply enough oxygen to meet the body's demand. This leaves you in a constant state of exhaustion because the body is literally being starved of the fuel it needs. If this kind of profound tiredness is new to you or getting worse or comes with breathlessness, you should seek same-day emergency assessment. So you find it impossible to lie flat comfortably and you're having to prop yourself up with more and more pillows. Or maybe you've even started sleeping in a recliner. just to get through the night without feeling breathless. The medical term for this is orthopnea. It still comes back to that fluid pulling up in the chest. By propping yourself up, you are using gravity to pull the fluid away from the chest, which then gives you temporary relief and make it easier to sleep. Needing more pillows to breathe comfortably at night is a classical warning sign that calls for same-day assessment. You suddenly become aware of your heartbeat. You feel it pounding, racing, fluttering, or you feel like it's missing beats. You might notice it especially when you are breathless or lying down. The reason this happens is because as the heart is constantly overworked and under strain, it can become electrically unstable. All that stress can interfere with its normal rhythm and trigger dangerous electrical patterns like atrial fibrillation. An abnormal rhythm makes the heart an even less effective pump, creating a vicious cycle that makes the breathlessness even worse. If you're having new palpitation and they're happening along with dizziness or shortness of breath, you need an immediate same-day medical evaluation. You are severely short of breath even when you are sitting perfectly still. This might come with a feeling of overwhelming dread or like you're suffocating no matter what you do. This is the most critical sign, known as acute decompensated heart failure. It means the heart has become so weak that it cannot keep up even when the body is at rest completely. Fluid is rapidly filling the lungs, which then prevent oxygen from getting into the blood. Your body is in crisis because the pump is actively failing. This is a medical emergency. Don't wait, and don't try to drive yourself to the hospital. Call your local emergency number immediately. If you recognize any of these signs in yourself, especially if you have more than one, I am personally asking you, please talk to a doctor. Don't just write it off as part of getting older. You have to be your own best advocate. And when you see the doctor, be specific. Don't just say, you're tired. Tell them, I have to use 3 pillows before I can breathe properly at night. Or, I wake up 2 hours after falling asleep, gasping for air. A doctor will examine you and do some tests. These tests are the fastest way to know if your heart is actually the problem. Waking up unable to breathe is terrifying, but understanding what it means gives you the power to take action. From gasping for air at night, to swollen ankles, to needing mountains of pillows to sleep. These are not random symptoms. They are clues. Your body is sending you a message. Ignoring that message is the worst thing you can do, but facing it head on could change everything. Thanks for watching, and if you found this video helpful, please share it. You could save a life by doing so. And if there are other symptoms or conditions you want me to discuss next, please drop it in the comment section. And for more health content that give you the power to take control, please ensure that you're subscribed. Take care and see you next time.